Life behind the mask comes with plenty of challenges, especially when it comes to reading emotions. But could it also be creating new ways of communicating? Take a look. They've become the symbol of the pandemic, as well as the isolation that it's brought. Face masks. Studies show that they can help protect us from the coronavirus as we go about our daily lives. But they can also keep us from understanding one another.
Something is different. It takes me longer to work out whether someone is happy to see me or whether they agree with me. Basically, I get less information.
Psychologically, for two pilots to be able to work as a team, it's critically important to be able to read your colleagues' emotions.
I went to the doctor and noticed that it was really hard going at the reception. I had to work hard to show that I had a hearing impairment and that I was having difficulties communicating. When the nurse understood, she was quick to suggest that we remove our masks.
As we cover our faces and practice social distancing, are face masks making us socially distant? I'm joined now by Rolf van Dijk. He's a professor of social psychology at Goethe University in Frankfurt, which is where he joins me from. Welcome, Rolf. First question, are we losing connection? Are we losing connection with one another because of these face masks?
Yes, that might be one of the problems of the face masks. Our research very clearly shows that social connection is extremely important, and during the days of the hard lockout, we weren't able to get in touch with each other. And now with the face mask, what is missing is mimics, facial expressions. And we humans have learned in millions of years of our evolution to read into each other's faces. And this is very important information that is missing now.
So do you think people are learning new ways of communicating with one another if they can't see those expressions?
I sometimes try to observe myself, and I try to communicate much more with my eyes and my eyebrows when I am wearing a mask. So it depends a little bit on how long this will continue. If we have to wear the mask in public for the next couple of months, maybe, then we'll clearly learn these new techniques. Yes.
Is it fair to say that face masks represent just one aspect of a larger problem during this pandemic, and that is social isolation?
Yes, that's right. Face masks are just a visible sign of it, but I think the social isolation phenomena are much more severe and are much wider or broader than the face mask alone. So people who do not live in families, who do not live in larger communities, have learned to not seeing their colleagues, their friends, their relatives for 2 or 3 months. And this is a huge problem.
You've mentioned also in the past physical contact, basic physical contact, something that we try and avoid with many people right now. That's also a form of isolation to not have that, correct?
That's right. And I mean, it's a cultural issue. I was visiting China a couple of years ago, and right afterwards was in Japan. So Chinese keep contacts much more than Japanese, for example, do. Germans are probably somewhere in the middle. So it's a difficult thing if you are not used to that situation, not being able to touch each other. It feels awkward. And we humans also learned in our years of many million years of evolution to console each other by physical touch and contact.
What kind of a psychological burden does that put on people to have to forego a lot of these social interactions?
I think it puts a huge burden on us. There are studies starting in the 1950s that have shown that children who were hospitalized for a few months or longer because of severe illnesses had severe impairments of their cognitive, but also their social development. We are working together on a corona project with people from 10 different countries. And just now the data from Kazakhstan came in. In Kazakhstan, Kazakhstan, between mid-March and late May, more than 800 people have killed themselves compared to only 14 in the year before. So that signals that something is going on. We don't know yet whether it also is because some people have financial worries or other stressors, but I think social isolation is a big factor contributing to that.
All right, an easily overlooked aspect of the pandemic. Professor Rolf van Dijk from Goethe University in Frankfurt, thank you for joining us. And time now to answer your questions about COVID-19. Over to our science correspondent, Derek Williams.
How will those who sustain long-term damage from COVID-19 respond to the flu this fall?
A lot of experts are worried that this winter we're going to see this kind of perfect respiratory disease storm, that a feared second wave of COVID-19 will coincide with the yearly flu season. Now, if that happens, it could easily bring health systems really to the brink. When it comes to influenza, one of the most vulnerable populations in the coming fall and winter will unquestionably be those people who have already been ravaged by COVID-19. For them, catching the flu in the months ahead could quickly turn life-threatening. That's one reason why doctors are encouraging as many people as possible to get a flu shot this year, most especially those who suffered badly from COVID-19 and might have sustained lung damage from it. A flu shot won't provide perfect protection, but it's much better than nothing.
Can tests differentiate between SARS-CoV-2 and the coronaviruses that cause colds?
This is a little complicated, so stick with me. When it comes to testing, you have to distinguish between sensitivity and specificity. Now, sensitivity describes how likely a test is to properly detect an infection with the virus. So it affects what are called false negative results. Specificity, on the other hand, describes how likely or unlikely a test is to confuse the virus it's supposed to detect with another one and report that someone is carrying the virus when they actually aren't. That's called a false positive result. Now, although the polymerase chain reaction or PCR tests that are being widely used in the pandemic are highly specific, their sensitivity can vary depending on, for example, how the sample was collected. So what that means in clear terms is that if you take a test and it turns out positive, you're very likely to have the disease. If it comes up negative, however, that's not an ironclad guarantee you don't have the disease. Test sensitivity is improving all the time, but it's not perfect.
What do you think of Sweden's approach?
Swedish health authorities have taken a risk with their unique approach to the pandemic. They didn't force businesses or schools to close, and the national strategy has been to strike what the government calls a sustainable compromise while protecting people at the greatest risk. But a pretty high death toll there, particularly among the elderly, has made a lot of people both inside and outside the country question and criticize what's going on. And as Europe opens its borders, Swedes are being barred from some other European countries and told that if they travel there, they're going to have to quarantine in others. So I personally really think it's still too early to say whether Sweden made the right choice or not. I mean, if we develop effective vaccines and treatments soon, it'll probably look like the wrong one. But if we don't, in a year or two, it could look like the only approach that really worked.